My views on the educational aspect of the role, especially the foundation degree, is very favourable. I found the prospect of going to university to get a foundation degree was enormously exciting. I couldn't quite believe it was happening to me. I'm waiting for the day when we graduate and when I get to wear the mortarboard and the gown and have that degree in my hand. That's when it will become real. That's what I'm looking forward to.
I completed the foundation degree at City College in Norwich in June of this year. I found the course really helpful for my being an assistant practitioner. The course really made me think about different aspects which we don't actually deal with on a day-to-day basis, but the course really definitely has benefited me in my role as it is now.
I thoroughly enjoyed studying for the foundation degree. I found it much easier learning about a subject that I care passionately about. It has certainly given me more confidence and a greater knowledge base which to improve my patient care.
My views on the degree and both on the competencies, that they were very good. I really enjoyed it, and the competencies themselves were each suited to each aspect of each ward, so everybody had different competencies, so we were able to go back and compare, which was really good.
Having opportunity to go out and learn new skills alongside my job is a dream come true for me. I've always wanted that. Having a young family, having financial responsibilities, having a chance to learn and progress is wonderful, and to have that funded, you know, it really has changed my life for the better.
You can transfer skills, what you're actually learning at college through lectures, bring them back to your team. I mean, when we did the dementia module, the pack I did, I've actually brought back to my team, and because not everybody's aware of so many different types of dementia, it's actually been a huge benefit for the team.
It's a really structured course. I've really enjoyed it. They've really set it out relevant to practice, and you can link it in to your practice and to your ward, and they really make it relevant to your ward as well.
Foundation degree has given me the basic knowledge behind anatomy and physiology and the workings of the NHS in order for me to carry out my role.
It was very challenging. The course is designed where you have 3 or 4 modules running at the same time, so you've got to be quite good at prioritising your workload, obviously balancing it with working full time as well. We went to college 1 day a week, which the trust released us for, which is obviously a commitment from them as well. So you've got to know when your deadlines are and be good at sort of juggling.
That for me was one of the most challenging and difficult 2 years that I've had to face, but since obviously having passed and qualified, I think I can now relate things a lot more, especially when the nurses are talking in more technical terms, and I don't think you actually realise how much you've learned at the time until after you finish the training. But it was definitely the most difficult 2 years.
I found a foundation degree, I felt that helped a lot. I think it learned how to manage time, how to work more efficiently, how to deal with problems that arise. And I think it's given a good opportunity to those who want to go further within their career to move on and use their skills they've got from before to be able to progress, to give that back into the service and to deliver to patients, really.
My view on the foundation degree is that it's a really good starting point for assistant practitioner. It gives a really good core basis for people to start. I think with the enhanced roles of the assistant practitioners, it's really good to kind of go on from there and develop in specific areas. But I think it's really well tailored to adding on to previous experience that people have got, adding sort of theories and models around existing practice.
So when you've got the patient in front of you, you know what's going on inside their body, you know what they need, why they need things. It teaches you the anatomy and physiology, it teaches you the social backgrounds, it teaches you from every aspect. so you're able to care for the patient as a whole, and you're able to understand why the doctors want certain things. So it's a really big eye opener, and it's a good pathway into nursing as well. So you go into nursing with your eyes wide open, and you know what to expect. So it's really good. It's a great foundation.
The foundation degree, I think, has really changed my whole outlook. I've worked in health for over 25 years, and it's enabled me to have a staff development pathway. In my current role, it has definitely helped me to understand not necessarily what I do, but why I do it. It gives it almost, as it says, a foundation. So you've got like foundation blocks to understand. I had an understanding of health through longevity, perhaps in a role, but this has given me an understanding of why we do what we do. The research into it, you can understand the research, you understand the role. And I'm really lucky that I've gone from being an auxiliary to a healthcare assistant to a generic worker. And I've just been told that I've got an assistant practitioner role. They're just fine-tuning it. So I've had, after all these years, a pathway. So for me, it's really positive. The tutors give you the support. You're learning from your own role. So your research and where you're looking at things is in your own role. I graduated on the same day as my daughter, and I felt just as proud of myself as I did for her.